India has reported more than 49,000 new COVID-19 infections, yet another daily record. The country now has more than 1.2 million cases. New Delhi is holding talks with leaders from 8 states which have seen a huge spike in cases, including Bihar and Andhra Pradesh. India is conducting more than 300,000 tests each day, and infections are expected to keep increasing, and there are now concerns over containment measures and the lack of healthcare facilities. Ishan Garg joins us from New Delhi right now. Ishan, Prime Minister Modi is meeting state officials from these hotspots. Is there a need for perhaps maybe a more coordinated approach?
There is certainly a need for a more coordinated approach, Glenda, because the last time we saw a federal directive come in which dictated the national policy towards tackling the pandemic was back in April, when India imposed a nationwide lockdown for about 70 days or so. And since then, we have seen the responsibility being cascaded down to different states and different municipal bodies. And in today's meeting as well, it is expected that Prime Minister Modi is essentially going to take a stock of the situation and understand from the states what their requirements are, if they need more medicine, if they need more production units, or if they need more funds just in general. But it would be fair to say that there wouldn't be any coordinated approach from this point onwards as well, because from what we have seen the federal government doing is that it has passed on the buck to different states, and now these states are responsible for taking care of the containment zones or the areas with multiple cases of COVID-19 inside their own jurisdictions. But what we can see going forward is that if these states demand one, another nationwide lockdown could be on the horizon, probably further down the line in September.
Ishan, despite that lockdown and the fact that the Prime Minister has to take stock of the situation, while all of that is happening, India has been reporting tens of thousands of new cases daily for weeks. And now we hear that drugs are in short supply.
Yes, that is absolutely correct. And as ridiculous as it sounds, that is the reality as well. And that's partly because a majority of the drugs that we are seeing are being stockpiled by private players, as opposed to government hospitals, which initially took on the responsibility to treat COVID-19 patients. In the past few weeks, we have seen several private hospitals stockpiling drugs like remdesivir in massive quantities. And on top of that, just to make situations worse, we are also seeing a massive black marketing operations in which people are selling essential things like ventilators and drugs like remdesivir, all the way to vials of blood that can be used for plasma donation therapy. So we are seeing a whole range of these issues, and to tackle them, several governments are taking different types of approaches. For example, in Delhi, we have seen that the state government has set up its own blood donation unit. It has set up its own state-owned drug department, which will supply medicine to all the hospitals, so that the middleman is taken out, the black marketing is taken out, and hopefully this is the kind of model that will be replicated by different states, so that there isn't a short supply of drugs and material in the long run.
A slew of challenges still facing India there. Ishan, thank you very much for that. Ishan Garg there in New Delhi.